Hello friends, I am Kaur and I am here again with you all with a new video on paracetamol toxicity. Paracetamol is a drug which falls in the category of non-steroidal anti-inflammatory drugs. It is a potent antipyretic and analgesic drug, but it also possesses weak anti-inflammatory action. The another name of paracetamol is acetaminophen N-acetyl para-aminophenol 4-hydroxyacetylide. Physically, it appears as white odorless crystals which are bitter in taste. It was first synthesized in 1877 in USA. It was more used during 1947 and got included in over-the-counter drugs in 1960. It is a metabolite of phenacetin and its first toxic effects were noticed in 1971. If we talk about the therapeutic uses of paracetamol, it has analgesic effects and antipyretic actions. As analgesic, it relieves mild to moderate pain by inhibiting the synthesis of prostaglandin synthetase. Its efficacy is equal to salicylates as it blocks pain impulses peripherally, whereas as an antipyretic drug, it reduces body temperature by inhibiting prostaglandin synthetase in hypothalamus. If we talk about the toxicokinetics, paracetamol gets rapidly absorbed in GIT completely. Plasma half-life is about 2 hours, whereas the peak plasma level reaches within half an hour. If we talk about the protein binding, it is 5 to 20% protein bound, whereas its volume of distribution is 0.8 to 1 liter per kg in case of adults. Paracetamol overdose is toxic. Due to overdose of paracetamol, it is converted into active as well as inactive metabolites. The fate of inactive metabolites is through renal excretion. They are being excreted out, whereas active metabolites which are non-toxic in nature, they are excreted through GIT, whereas the active metabolite which is N-acetyl para-benzoquinone imine NAPQI, that is the toxic metabolite of paracetamol. It accumulates by conjugation with glutathione and it causes hepatotoxicity and liver damage. The clinical features of acute poisoning of paracetamol are divided into 4 phases. Phase 1, it ranges between 0 to 24 hours and it is causing nausea and vomiting, whereas phase 2, it reaches between 24 to 72 hours, whereas phase 3 between 72 to 96 hours and phase 4 between 4 days to 2 weeks, as we can say here. During stage 1, there is no specific symptom, it is asymptomatic and lab studies of the patient are normal, whereas in stage 2, it reaches between 24 to 72 hours. In this stage,